Hi, I'm Dr. Laura Hanson. I am the owner and founder of Original Development and Therapy Center. This is part of an ongoing series educating parents, family members, teachers, therapists, and the community at large into the marvelous development of children. If you happen to be somebody that knows a family member or just a friend who has a child with any kind of neurobehavioral challenges, we hope that you will continue to watch. Today's video is about development and as it relates to developmental milestones. In working with children for over 17 years, one of the common statements I hear from parents is that they were told that it didn't matter if their child crawled and it didn't matter when their child walked. Early on in my professional career, I too thought all children will do things in their own space and time. However, today I know that that's not true. In fact, the way that the brain gets developed is through sequence and progression. When you come into this world, you are brainstem dominant. You are fully formed, but you are not fully functioning. In fact, what exists down in that brainstem is survival. It is all the vital parts of breathing and heart rate that keep that body on. Also, your cranial nerves are there. The cranial nerves go to your eyes, eye movements, facial expression, smelling, tasting, hearing, touch, all those things that are our special senses. Then your child has to be introduced into their environment. That environment is what's going to turn on that higher brain. And when we talk about environment, we are not only talking about the environment that they live outside, but also that internal environment. And they coincide together and they work together to mature each of these fabulous systems that we call baby human. To start off with today, let's look at developmental milestones. There's 5 categories in which developmental milestones are evaluated. That is fine motor, gross motor. That is your big muscles and your little muscles, social, communication, and adaptation. Each and every one of those, regardless of the age of your child. In fact, developmental milestones are utilized all the way up into your teenage years, and I believe we could take it up to college freshmen because we are continuing to mature even as we enter college. But for now, let's keep it to children. When you develop, you go through a sequence of movements. We all know that when the baby gets here, we're just marveled about how they lift up their head. They're lifting up their head in gravity. That's a very important part of how development gets started. The baby was in one environment and now the baby's out here in gravity. In fact, if I were to take a newborn right now and hold the newborn up on this desk, put my hands underneath their arms, hold their chest, what we would see is that little baby would begin to reflexively move their feet. The pressure that they feel from the table would create an environmental trigger which would cause that reflex to begin. But if I were to move my arms, that baby would fall down because that baby has not learned how to be in gravity yet. So that's the foundation of our development, how we are going to respond to the gravitational influences out here. So the baby begins to work in gravity, lifting its head, rolling around, beginning to scoot on the floor, raise their bottoms up, getting ready to do a cross-crawl pattern. But before they can do a cross-crawl pattern, other movement patterns have to be inhibited. For example, when you come here, you perform more of a homologous movement pattern, which means that everything moves all together at one time. Well, we certainly couldn't stay like that because we'd have very jerky movement patterns. So gravity begins to help us break up those movement patterns. The next pattern that we see established is called a Homo lateral pattern. That pattern is connected to a reflex known as the asymmetrical tonic neck reflex, where I will turn my head to one side and the arm and leg on that side will also go out. This is the beginning of near-far vision, as well as creating the next foundation for when the cross-crawl pattern will come in. Now, if that reflex does not inhibit timely, it will completely interfere with that child being able to crawl. So when we look at milestones, we have to understand that an avoidance is just as important as doing it too early or not doing it at all. We want to know, why wouldn't that child get into that pattern? Children are marvelous at adaptation. They're going to keep going. Their brain waves are so fast. But oftentimes, avoidance is where these neurological interruptions begin. Now, once that child crawls, what's being laid down at that level is the cross-crawl pattern. That's where information is coming in from the periphery, going up the spinal cord and crossing over to the other side of the brain, and vice versa as it comes down. So this is a very important part of neurological maturation. Without it, you have a very robotic-like gait pattern. You have a very difficult time coordinating timing between your legs and your upper body. And the eyes have a very difficult time in crossing the midline. These reflexes and motor patterns are all interwoven into a circuit of neurological development. And then as that child moves on in its sequence, it begins to crawl over to furniture, pull itself up. It will bounce up and down, moving all those joints in so many different directions, building proprioception, getting ready to stand up in gravity. They will do this activity over and over again until they innately know it's time to take a step. And when they take a step, they are ready to walk in gravity, but it's still not like an adult pattern. In fact, the next pattern is to be able to take that body that's upright into a whole series of maturation. Now that's just looking at the motor part. If we go back again to that first year, looking at communication, babies are making sounds as they are beginning their development. They make their vowel sounds first. They ooh, ah, those are your vowel sounds. And then over the next few months, they'll add the consonants to it and put mama, dada together. And it will actually only come out in a single syllable before it will go to a double syllable. What we do with the developmental milestones is we look at the origin of your child's health. Where did the sequence of maturation get interrupted? This is how the rest of the brain, the higher brain, the frontal lobe, executive function, this is what it's counting on for development. Simultaneously, while all these movement patterns are going on, inside your baby's body is also developing. The gut matures over the first 2 years of life. You are acquiring sounds the first 3 years of life. Your cerebellum, or the back of the brain, is really pulling maturation together the first 4 years of life. We could go through every part of the body and it would show you an open window of development. When children have that right environment internally and externally during those open windows of development, we have a child that thrives. Our goal here at Original Development is to help you get that child thriving.